So we're going to do NUR203 Exam 1 um, review. Hopefully I'm going to make it in a way that you can understand it. Now, what I ask all of you is when we're going through this review, if there's something you don't understand, you're not quite getting it, you need further explanation, please do not be afraid to stop me. I don't get upset, I don't get frustrated, and it doesn't stop my train of thought. So don't worry about that. Furthermore, if you have a question, somebody else does too. So here we go. NUR 203 exam 1, chapters 26 through 35. It's a lot of information, but let's break it down into the things that you need to know. So as I said, your theorists are going to be your big thing. Remember, Erickson's all about how the child relates to the environment around them. This is psychosocial. How do you relate physically and mentally to people? How do they affect you as you grow up? In another word, so trust versus mistrust. These are infants up to, like middle toddlers, up to 18 months, they say. But the trust is what do infants do? And what do they need? Well, when they cry, they want someone to pick them up. They want to be changed, burped, fed, held, and played with. So when you do that, that infant has trust that when they cry again, somebody's going to come. These are going to be happy, healthy, well-rounded infants because their needs are being met. Their environment's taking care of them. Now, the mistrust is there are some environments, it could be homelessness, it could be poverty, it could be drug addiction, just abuse is going on, and some infants aren't picked up once, but all the time or most of the time. Well, that infant, when he cries or she cries, nobody's coming to get them. So they don't trust their environment to take care of them. So they're not that happy infant like that trusting one. This is a very well tested section to let you know. Erickson, all of them, on any different exam, you might see them. Now, toddlers. So you're 18 months old. Remember, you're walking and you're exploring the world like crazy. What do we know about toddlers? Me, mine. No, no, no. I do, I do. This is a toddler. Selfish. Autonomy. They want to do it automatically. Mine. Me. I want to do. That's what autonomy is. Well, what is that shame and doubt? Well, that's mom and dad and grandma and grandpa going behind. Say, no, be careful. Don't do that. Don't jump. Here, let me help you get dressed. Well, let me tie your shoe. Let me help you put it on. And you do not give that child a chance to do it themselves. The helicopter mom type of thing where you don't let them, they have to fall, they have to hurt themselves a little bit. But, you don't want them to, be in harm, of course, but you got to let them do things. So then they get the shame and doubt. Well, it's there. I want to explore, but I don't know. Can I? Should I? And that's the shame and doubt. All right. You need to let a toddler explore. It's the way that they learn. They don't do it. They don't understand it. They're not going to do it. So you need to let them grow. Now, initiative versus guilt, probably the least tested of all the Erickson. But what does the preschooler basically says? They're more self-confident. They can start to feed and dress themselves and do all these things. They can start helping mom and dad. But there are times where they don't do it completely right or correct. And that's the guilt. The initiative is they go ahead and they do it. The guilt is maybe they didn't do it right. Or maybe they're potty trained and they didn't wipe their butt completely. That could be the guilt. Well, at least I tried, mommy, right? So I'm going to try, but I'm going to feel I didn't do it all completely. Feel guilty. Now, probably the most difficult because of the wording is your school age. Now, school age children, 5, 6 to 12. As I've told my class, you're going to see differences. Some stages for school age say 6 to 12, some say 5 to 12. But for us, let's just say 6 to 12 is school age, okay? Now, industry. What is an industry according to psychosocial about people around them? Well, I have an industry, I have a product. I have a factory. I have things that I produce and I produce well. Well, school age children, what might that be? Well, they might be good, the best at math. They might run the fast. They might be great at spelling, or they might keep their room really clean and they like that. That's their task that they've mastered and they do it well. Well, can you do everything well? No. That's the inferiority. They want to do everything as well, but they can't. And that industry gives them that feeling of pride and accomplishment, and they're feeling good, right? It's part of feel I got a good product and I'm delivering it to whoever. Now, adolescence. Well, think about adolescence. This week's lecture is all about adolescence, and they're all about body image, about who am I? What do I want to be when I grow up? What college? Do I like girls? Do I like boys? Do I like them both? Do I like to be in the art club, the drama club, the sports club? I got to fit somewhere. That's part of adolescence, that identity. Where do I feel good at? Where do other people make me feel good at? That's an identity. And that's how adolescents identify that. Now, what is that confusion or role confusion? Well, it's exactly that. I don't know what I'm going to do, what I'm going to be, but I need to feel good, body image. When I don't, I'm depressed. I need to feel good here, and that's with me and with others and in the groups. Okay. And that role confusion is about, when I was younger, I wanted to be a fireman, but now I want to be a lawyer. But no, now I want to be an artist. It's that changing, that role confusion. I don't know what I want. So, Freud, as I said, anything sexual. As an infant, it's all about mouth. They explore the world and comfort themselves with their mouth, whether it's with a pacifier, with a finger, a blanket, a toy, anything in the mouth. And that's how they self soothe, right? Anal is all about potty training. This is your toddlers. Preschoolers is all about boys are drawn to mothers and girls are drawn to fathers. And because of the potty training and they understand themselves and they realize there's different parts, they're starting that exploration um, with it. And it's part of being normal. Now, latency. This is the Freud's name. Like, why latency? The other stuff you can make sense of. But this latency word, what is it? All it means is that they children like to hang out with same-sex peers. So girls with girls and boys with boys. And remember, this is a break away from the family. So this is now other people's cultures, ideas, feelings, customs, right? They're starting to learn more about the world. So same-sex peers. And then, of course, you get to be an adolescent, and then all you think about is your genitals, which is very easy with Freud. Now, Colbert, when the child is younger, now infants and toddlers don't really have morality yet. The older toddler might understand that you shouldn't do that. But what Colbert says is at preschoolers, children know the right and wrong, and they understand it by reward and punishment. They do something bad, I'm going to be on timeout or something's going to happen. And if I'm rewarded, oh, I get a sweet, I get more time on my tablet, whatever that reward is. And that's how they're driven for morality, that reward or punishment. Now, as they get to be school age children, they're not into that reward and punishment anymore. School age children want to please others. They want to conform, they want to please, they want to do good. That's what they want. And then after that, that post-conventional is the adolescence. It's doing things in society that you're supposed to do, as simple as stopping at a stop sign, or making a right turn on, or opening the door for someone in courtesy. It's what behavior is acceptable in society altogether. Not smoking inside stores, has to be outside now. I mean, all of these rules of society, those are post-conventional. We do put in Fowler's here, not necessarily the name Fowlers, but this is talking about spirituality, right? Everybody has their own beliefs. So, do I have to put my beliefs and believe in yours when I take care of you as a patient? No, but I have to examine my own, know what my spirituality is, and give you the time for you to practice your spirituality as long as it doesn't interfere with the medical plan that's going on. So, spirituality is I know who I am, I've examined it, and you have your religion, and that's absolutely fine. And you let me practice mine, you can practice yours, and I will fit my schedule into that. It could be somebody praying 6 times a day, right? I've got to fit my plan of care around that because it is a respect. That's the cultural side of that. Now, Piaget. Okay, this is all about thinking. How do I think with the world and environment around me? And as I said, it starts out with learning how to breathe when the butt is hit. Oh, okay, now I breathe. That's the first thing you did. Did you do it consciously, unconscious? It didn't matter. Then they put a bottle in your mouth because you need a little sugar water or something right after birth, right? So now you're sucking, swallowing, and breathing. This is all learned. You didn't know this behavior before that. And then it was grasping a rattle. It was a reflex. And then you put it to the other hand and grabbed it yourself. Now that's voluntary. So what Piaget is saying is you've got to start out with just grabbing it for whatever reason. Oh, it's there. I like it. Oh, now let me grab it. I like that. And then all of a sudden it moved and it made a noise. You go, oh, the next time they take it, grab it, they move it. Oh, I like that noise. And then maybe they put it in their mouth and explore the world in their mouth. That's all that primary, secondary type of circulatory reactions. That's when they take the sippy cup, throw it on the floor. Because the last time I did that, mommy came back. She was in the kitchen or somewhere. I wanted her to come, so I hit the sippy cup back on the floor, and she heard it, and she come running back to me. They planned the response because it happened before. They've seen it before. Okay. Now, pre-operational, those toddlers and stuff, it's a lot of this magical thinking that's going on after we're starting to learn more. And then it becomes into brooms, our horses, and you put your arms out in your airplanes. And then branches on trees are an umbrella to cover the tree from getting wet when it rains, and animism, and learning all this magical stuff. That's in that preschooler area. Now, you get to school age, what happens? Well, school age children, yeah, they're still magical, but they're more doing what they've already seen, done, touched, or felt before. Concrete is hard, it's solid, you can touch it, you can smell it, you've seen it before. Now, those are behaviors that I can replicate because I've seen it before. And that's when I can do it. So concrete, think of what I can do. I can touch it. Those are things I already know. All right. Now, as we get to adolescence, these are the most amazing thinkers, critical thinking, figuring their way, as I call it, out of a paper bag to get whatever they want. And this is the example I'm going to use. Adolescent was told by mom on Monday, the child got a D on a test. They're not going out this weekend. Oh my God, Friday night is my girlfriend's party. I have to go. Oh, well, you're not going to go. So that adolescent goes, how can I change mom's mind? And I need to stop talking like this because she's getting angrier and, oh, she won't let me. So I make my bed. I take out the garbage. I make dinner. I put the coffee on in the morning. I get a B on another test. I do this. I do that. I walk the dog. I don't know. And on Friday night, mom says, okay, because you've been so good, you can go. That's formally figuring out what you got to do to meet whatever goal you want to make. Does that make sense to you now? Formal. Concrete, you have to see it to do it. Formally figuring it out. All right. These are all pictures. They all say the same thing. If you want to read some more, go ahead. But I've just explained it to you in a manner you can remember me or think about those key words. I think you'll get through those theorists without a problem. Okay. Now, play. What do everybody do from the moment they wake up in the morning? I mean, us, we're on our phones, right? Trying to figure out who called us, who texted us. Is there an email? Is there something due for school? Right, right, right. We're always playing. Well, we start as an infant and we work onwards. When we start talking about play, we usually start talking about those toddlers that are up and sitting and walking and, can sit next to other children type thing. Now, play, onlooker. I'm just watching. That's all. Not doing anything, watching. Solitary, I'm playing alone. That solitary play is a lot of autistic children. They play alone, they can't play with other kids. They're usually by themselves. Now, parallel play, associative and cooperative. These three things you need to know. And let me explain it so you can understand it to know which group. One is toddler, one is preschooler, and one is school age. Toddlers, what do you know about toddlers? Selfish, me, mine. Parallel play. Two kids sitting next to each other playing, but you're not touching my toys and I'm not touching yours. They're mine. They don't share. They don't talk. They play by themselves. This is a toddler. Selfish. Then they get to be preschoolers. Now they're all with all the toys, and there's two or more children, and they're all playing with the same things, and it doesn't matter. They're sharing, it's thing, all that's going on. But there's no goal. You don't make a house. It's not like checkers winning a game. It's just they're all playing together. It's what mostly, preschoolers, will do. And you get to the older preschoolers and your school age children. Now you have cooperative play. It could be as simple as playing checkers, as in there's a game, you play it, and somebody wins, or that there's a goal in the end. It could be building a sandcastle, making a train track, cooperative play, where they all work together, okay? And there's a goal in the end. That's what you need to know about play. Cultural care, I've already mentioned it early, with it, no, with cultural differences. Know that children, older children know what they need. Remember, adolescents, you can ask them any preferences. It's better to ask, with culture. Sometimes you can't have a male nurse with a female child. You have to be careful about disrobing, many of those things. And again, just as it says the last thing, make provisions for spiritual care by first examining your own spiritual perspective. Know who you are. Where do you come from? And then let you be who you need to be, is all of that. That some cultures are vegetarians, don't eat beef, don't eat pork. Again, whatever preferences in their care, it's either ask parents, ask child. Now, assessments. It is not a head to toe. If this is not an adult, it ain't going to happen. So, how do you perform an assessment on a child? First of all, as a person, now, I'm a large woman. Standing above, I tower. I'm also tall. So these children would be totally scared of this large person. So I always would actually sit a little below them. They're on a stretcher or bed. I'd get in on a chair and pull it up next to them. And then I would start saying, "Oh, you've got cute eyes. Oh, I love that Batman shirt." Or, "Where'd you get those freckles?" Or, "Oh, your eyelashes." An older child. "How do you like school? What's your favorite subject?" All of these things sound arbitrary, but you're going to see which child sparks up to what question and they'll start talking. Maybe it's what's your favorite superhero, you know, figure it out. And then from there, now you're playing. One of the key things is knowing when to assess and how to get the best assessment. For instance, infants. You walk into a room, an infant's asleep. Do you let them sleep? Or is this the perfect time to listen to lungs and to heart sounds? Yes, it is. And that's where you would start. Whether it's a respiratory issue, it's quiet. And infants never quiet. They're when they're awake, so you can't hear the breath and the heart sounds like the way that you should. Know that one. Also, you go from least invasive to most, and I say the blood pressure is the most invasive. Children hate it. That big squeeze. So I've got to talk out about it. That it's a big hug, and I'll put it on their legs mostly, not their arms. Arms hurt. Okay. Now, another thing with assessing, and you get a child, suspected child abuse. Now, the mother, father, caregiver, guardian has brought in this child to be examined for possible sexual or physical abuse. Now, we worry about the child all the time. Don't forget the parent. If I was that mother, I'm bringing my daughter or son in with these accusations that I want checked. I'm pretty certain this happened. Can you imagine how horrible I feel? Remember the parents' feelings, okay? Another thing about parents is there are some parents, some guardians that like their children to be sick because they like the attention for whatever. I don't understand it, but it's called Munchausen syndrome. This is a person who keeps the child sick. They take like a wound that's open, they'll put dirty mud in it or feces in it or get water out of the toilet and inject it in IVs. And I mean, I'm doing crazy things and I don't know all of them. I'll bring food in with poison in it. And it's why I don't understand. I don't, it's a mental problem. But it's not ours to cure the bush housing. What is our job? Protect the child. So, how do we protect the child? Number one, you don't have to always have anybody in the room. No. But when that caregiver comes to the hospital, you must have a hospital person in there monitoring that child with that person in the room. Also, if they ever bring anything in, it must be looked at. So those two things with mush housing. And the goal is what? Protect your child. So growth at any age is nutrition, 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 nutrition. You know, you'll never hear me say more about what is the most important thing in the first year of life. Nutrition, nutrition, nutrition. So a healthy diet makes us alert, cognitively bright, our motor, fine motor, gross motor skills are where they should be because our body is being fed what they should be given. Now, what if now remember, at 6 months, an infant weight doubles. At 1 year, it triples. Now, why do you need to know this stuff? Well, nutrition is one of them, and then hormones like thyroid and growth hormones later on. But right now, we're talking about growth on this child. So, nutrition, if it's not given enough, the weight will be less. So if you have a child at 6 months, born at 7 pounds, who at 6 months weighs 10 pounds, they're not getting enough nutrition. We need to do something. And also, if we see a child more than that, we got to find out why. Are they giving extra fruit juices or what's going on there? One of the ways that we can determine nutrition, any age, from infants to adolescents to us, a 24-hour food diary. It's the simplest way to find out what is any age child eating, right? So again, height and weights are monitoring nutrition and other stuff too. And again, how else do we monitor nutrition? Besides height and weight, it's also going and looking at that diary. What's going on? What are they really eating? Again, I don't go into body mass here, and I don't look at numbers and how to figure it out. And there's not a question on it on your exam. So don't get like, do I need to know this formula? What you need to know about is being heavy or being obese. And those things are, they say, if you are in the 85 percentile in your BMI, body mass index, you're at a risk to be overweight. But when you hit 95%, you're obese. And those are the numbers you need to know. Okay. And again, it's here again, food diary can help, not just adolescents, any age child. Again, developmental assessments are done in order to early detect deficiencies, find out why, and to supplement it. There's all programs, all different age stuff, and that's what that slide goes into. Cardiac assessments. Now, next quarter, you're going for capstone. I know they're going to have you listen to all of the cardiac and telling the proctor where all the valves are. Well, this is another review from health assessment. It's the reassess here, knowing where the valves are. Now, do you need to know exactly where they are and all the numbers? You need to know that there are valves, and we need to know that there can be murmurs in any of those. One of the things that we need to know heart sounds for is assessing heart rates. Now, if you're listening to a heart rate and a breath sound on an infant, it's going to be the fourth intercostal space on the left side. Always know that any heart rate on small children should be done for 1 minute, okay? And again, that sleeping baby is a perfect time to listen to those things. Breath sounds. Now, children in general, they always have mucus in their nose, right? You're always telling them to blow their nose. You always and always with their hand and their shirts coming up, right? Um, because of that, when you try to listen to breath sounds, it's hard to determine is it upper or is it in the chest. So these are the different types of breath sound. The bronchial is right here, right? That's the external notch. And this looks at upper airway. Now, upper airway is mucus. Below the nose, it would come out, right? And then the sounds would disappear and the lungs would be clear. So if this is clear here, the lungs are clear, all right, we're good. If they're junky up here with these noises in the oral pharynx, those lower breath sounds, if you hear noises, it probably could be noises. You just have to listen better. So this is bronchiovascular, is over the upper interscapula, the vesicular, the lungs. What do they sound like? And then, of course, those advantageous or those referred sounds, as I've said, probably are upper. Car seats, what do you need to know about them? Well, we know that all infants should be in a car seat, rear facing, in the middle of the back seat until 2 years old or onto 30 pounds. At that time, you can turn them around in the back seat. When you put an infant in that car seat, the safety strap should fit snugly around. Use blanket rolls to snug them in to keep them comfort and tight in that car seat, okay? One of the things about, car seats and children, is making sure that there is expiration dates on them. It's something that I didn't even really know because honestly, they didn't really have mandatory car seats 40 years ago when my son was born. So something that I've learned about. And honestly, that little silver box up there, I remember my brother sitting in that in the front seat with me next to him and my mother and father in the front seat. So that's how far car seats have come and the safety for our children. So infants, these are all the things, developmental stuff. You're going to see these somewhere, somehow, some way, and got to figure it out. So what is head lag? Do you know what that is? Put an infant on their back, take their arms, pull them up. If their head comes with the arms, if they move, their head is good. They got neck control. Now, babies at birth don't have that. About 3 months old, you should take their arms and the head should come. If it still hangs back, that's a head lag. The head didn't come up with the body. That means they are a gross motor skill. It's the first they should do it at 3 months. They can't, something's going on. It should be investigated? Is it something neuro? Is it nutrition? Nutrition, cognitively delayed, be nutrition. So a lot of these things is what we look at. Again, only back to sleep. We know SIDS death are caused. It's in the first about year of life. We know that smoking, we know cohabitation in the bed, we know that overheating, upper respiratories, male, um, children not breastfeeding are higher at risk for SIDS. But something putting them on their back to sleep is good. And remember, putting them on their tummies during their awake time so their heads don't get all flat in the back. So they go from their abdomen and back about 5, 6 months. You'll see that abdomen to back to abdomen, 6 months, completely rolling over. In their back, all of a sudden they found their feet, right? Where they're looking at the environment. Part of what Piaget says, find their hands, find their feet. Tooth, when they start coming. Now, you might see them at 6 months. You may not see them till 15 months, but the first is usually about 6. They can go from their backs, get up and sit up and stand on a couch at 9 months. It's also called creeping as they get and they around the thing. Sitting unsupported by 8 months, probably one of the most tested questions. Sitting unsupported by 8 months, no pillows, no nothing. They can sit there. And then, of course, by 1 year, maybe attempting or taking steps. Now, colic is gas. It is a child who's getting enough food, but just cries. It usually goes away about 3 to 4 months. We don't know why. It doesn't matter, breast, bottle, it happens. But one of the things as nurses, because we know we can have babies crying a lot because of colic, we know that. But never, if a parent ever calls in to the ER or doctor's office or whatever, and a young infant less than 2 months old, and they're telling you they're crying all the time. Don't just say maybe they need gas drops or stuff. That child needs to be seen by a physician. Think about a newborn infant. They're totally suppressed. Totally, there's no fight in them. And if something's going on with this much pain and vigor, it must be investigated to say, yes, it is colic and not something more severe. It could be so a lot more in their tummies going on. So, sequential trends, developmental pace, sensitive period. Sequence is that sequence of growth that happens. Their head gets up, then they roll front to back to front, then they get up on start, crawling on their knees, and then they're going to be sitting, and then they're creeping, and then they're standing, walking, and then they're talking by 1 year. That's a sequence. Developmental pace is the kid does it when they're on their own pace. As long as they're moving forward, it's fine. And sensitive periods are that time where they make these big movements in it where it's the psychological development, the thinking and the understanding as they're going along. So those are just some definitions for you. Now, fontanelles, why do we need to know this information? Well, this one on top, it stays open to about 12 to 18 months. That one in the back, posterior, about 2 to 4 months. It's going to be closed. Now, what if it's closed at birth? What if the posterior is open at 1 year old? What if the anterior fontanelle is open in the child's 2? These are all abnormal things. And then what do you think we have to do? We have to tell the doctor, and he has to x-rays or whatever needs to be done to find out what's happening. Why aren't those sutures closing? Because they should be closed by about 1.5 years at the longest, okay? That's why you know the time frames. Binocularity, babies are born with 2 eyes that look in their own way and their own direction. They don't work together. And what this means is there's no depth perception because this eye sees it here, and this eye sees it here, and a baby's going in the middle, and oops, where did it go? And that's binocularity. Usually about 12 months, 9 to 12 months, it's going to be better and they have better depth perception. Now, pain. What would you see in pain? Well, there's two scales that you'll see, black and faces. This is an infant. An infant is nonverbal or it's less than 3 years old. So they get the flack scale. What do you see in flack? Faces, legs, activity, crying, consolability. Well, these are the symptoms: crying, grimacing, that little chin, little quivering. They close their eyes tight, and then their arms and legs go, and you might hear them grunting a little bit. So, what can you do to help an infant with pain? Well, number one, sometimes it's just picking them up, and sometimes it's giving them their self soother, a pacifier with a little bit of sugar water on it. It has been proven it's just like morphine by some Harvard psychoneurologist that did this study about morphine and sugar on a pacifier. And they said sugar with pacifier had the same effect as morphine on circumcision. It was what they did. So give them that little pacifier, self soothing, and that comfort. Um, Maybe it is surgical. Maybe they need other pain. But first, remember, start those non-pharmacological and then give them whatever medicine they need. I've already just talked about SIDS, but anyway, these are all of those things about it. And I think I said basically the whole thing. Bed sharing, recent viral, maternal age less than 20, premature, low birth weights. I think the one that kicks all of those in is that recent viral where they've got that extra mucus in their nose. Suck, swallow, breathe. They can't do it. Infant reflex. Moral is like startle. Makes a noise, or you hit the crib, their arms and their legs come up. It's just what they do, moral or startle. What is this over here? That's the rooter tutor, as I call it. It's the rooting. I'm rooting for food. Give it to me, whether a breast or a bottle. We've already talked about the grasp, whether it's voluntary or if it's a reflex. That step, you pick them up, that legs will go. And just like adults, the Popinski. We have the same thing as babies. Parachute reflex. Ever take an older infant, 6 to 9 months old, turn them around in their tummy, put them down in the crib, you'll see their arms and their legs come up. It's just a reflex. It's called a parachute one, okay? It stays there. In fact, as we get older, the first thing we do is put our hands out when we go to fall, right? Again, if we're not seeing that, something's going on. And it'd be something that we need to look for. Nutrition. First 6 months, breast milk with vitamin D supplementation with it, or iron fortified formula. Breastfeeding should be 8 to 10 minutes on each. Knowing if they're gaining weight, they're fine. All right. At birth, they lose weight, they'll gain weight. We know that they're eating good, especially breastfed if they're 6 to 8 wet diapers. And that's nutrition. Now, after that, about 4 to 6 months, most of the literature says, this says it's 6, right there. They start what we call solid foods. Now, solid foods are given one at a time, and every 4 to 7 days, you can put another one there. Now, you never put two together. What if they have an allergic reaction? Which one was it? So you don't ever do mixed vegetables or something like that. They say start with rice cereal. It's the one that works the best. It could be a rash. It could be diarrhea. It could be vomiting, cramping. It could be all of these things. So look for it. Another thing, so we start weaning them from breast or bottle at 6 months. We should make sure we feed the food first, and then we'll give them milk. Now, still at 6 months, they still need iron fortified formula or breast milk. If they cannot continue breast milk, iron fortified formula to 12 months is what they'll have. At 12 months, they can have whole milk. And they need all that fat. It's because of the central nervous system in their brain. They need it. So it will grow good. Some mothers wean right off, some don't. You have some mothers still breastfeeding at 4. These kids are 4 years old. It's their choice, whatever they want. I don't, but it's fine. And another thing that we don't think about, you need a dairy alternative. Soy-based yogurts can be introduced at 6 months. And I think that is a nice difference. Immunizations. Well, you need to know Hep B is given at birth. And then at 2 months, 4 months, 6 months, we're giving them like crazy. Know that immunizations at that 2, 4, 6 months, they're giving multiple immunizations, most times both legs, and we know that they can hurt. And it's usually the mother's concern because their leg gets so tender and so sore. Remember, topical anesthetics can be used to reduce pain, encouraging them to take Tylenol, using ice intermittent on it can help. But immunizations first year um, are important because they're losing all of mommy's immunization. And that's the schedule from the book. Toddlers, the head and chest circumference. Remember at birth, the heads are huge and the chest is smaller. By about 1 year, year and a half, the head and the chest should be equal. Now, why do I need to know that? Well, if the head is still bigger than the chest, the child's 2 years old, something's wrong. So it needs to be investigated. So that's why we need to know all these things. So I've already said how to approach a toddler, get below them, start, peripherally out, going from least to most intrusive. And again, use play. And I always, it was part of my dissertation and something that I gave the hospital a program about holding children for immunizations, IVs, or even suture application by parents. It's found that a child held before, during, and after these procedure does so much better because they have the comfort of mommy, that they're staying with them. So it's a program that I left at the hospital called Huggies, still there. Toddlers, pain. Oh, toddlers, ages 1 to 3, right? So we're still on the flack. How do we know a toddler's in pain? It's when they're sitting in the corner and not doing anything and sucking their finger and not playing. And they don't want their favorite apple juice or favorite fruit. Something's going on. Um, they'll tell you. Now, black is used for infants up to age 3 and any child nonverbal. Know that there's a lot of other, distractible, non-pharmacological things that we can do. Children, distracting them, oh, it's easy. Turn on the TV, turn on music, have them start on their iPad. I mean, distract, let's take out cards, stickers. They're going to forget about that pain a little bit. And it does help. The other thing, if we're trying to select a route of administration, know that if they have an IV, oh, please give me my IV medicine. Don't have to stick them again. Intranasal, IV, and oral are your best ones. We have to stick a needle in them. They really will be uncomfortable. Many times, nurses will even put topical anesthetic before pain medicine just because they don't want more pain. As I said, toddlers go really slow. So all you need to know about their growth, they're picky eaters, psychologic anorexia. Do not give them snacks, juice, anything before meal times, so that when the meal comes, they'll be the hungriest they possibly can. Because them only want chicken nuggets, macaroni and cheese, and apple juice, and they don't want nothing else. And that's many toddlers today. So again, try to do everything to make their appetite the best you can. And I know it's difficult. Growth and fine motor development. Toddlers, they're up, they're walking, they're getting improved. Both hands are using, throwing the ball, walking up the stairs. Again, toddler, parallel play. Me, mine, and not sharing. They feed, play, dress, undress themselves in not maybe the right proper way, but they want to do it themselves. At 1, they have one-word sentences. By age 2, it's multiple words. They're starting to play a lot, talk a lot. Toilet training, you have to have those good 3 signs of potty training readiness. It's basically they're starting to say, dry for like 2 hours, and we know that start getting ready. Now, potty thinks you learn how to go pee-pee in the potty first. Most of the time should be the stool. Bowel control is accomplished before bladder, and it should be accomplished first because you feel it there. You have the stronger urge to defecate, okay? So know that one. Injury prevention. Injury. Number 1, oh, always motor vehicles. Always, always, always. Time outs, temper tantrums. Temper tantrums are common. Should walk away unless the child's going to hurt themselves, and they'll come out of that. It's just part of me, mine, mine. I want it. um Timeouts, 1 minute per year of age. You need to sit them down in one place, whatever that timeout place is. Tell them what they did wrong. Tell them when they stop crying and making noise, the timeout clock will start. And you're 2 years old, so 2 minutes. I'll tell you when we start. And that should be the timeout. If you're 10 years old or 2 years old, the timeout. Um, Parents should be taught that if, especially, remember, toddlers into everything, everything in the mouth and exploring the world, right? Anything that goes in the mouth that can be perceived as poison, number one, call poison control. Why? It may be you can drink some milk or something, or drink apple juice or lemon or whatever that can help neutralize whatever they ate as you're going to the emergency room. It's a dual thing, but call poison control. This is actually a number. If you're parents, you should have that number right into your cell phones just in case, because you don't know when it will happen. You could be the best, tidiest, cleanest, and it's going to happen to you because that's the people it happens to. Preschool, everything slows down, more mature. They're still picky and they still might refuse stuff, but they're eating a lot better. Colbert, remember, now morality starts in your preschooler. Again, reward and punishment is what you know about preschoolers. Right and wrong, a consequence for each. They know it as reward and punishment. Remember, preschool children feel that if they cut and get blood, they're going to bleed to death. This is the age of band-aids. Make sure every toddler, parents, preschool child has band-aids. I think I have 1,000 of multi-different type of character band-aids in my house. And if the kid gets a little piece of blood or I get blood, we get band-aids. And let me tell you, it blocks it up, the insides won't come out, and they feel better. Remember, part of getting hurt at this age is what, and it's preschoolers, it is school age. They feel if they got hurt, fell down, got a boo-boo, you broke their arm, whatever, that they've done something wrong. God is punishing them. Absolutely normal for this age, okay? Those are your pain scales. We know that. I'm telling you, little kids taking and pointing to that little number 4 or 3, my heart breaks for them because if they're giving you a sad face, they really hurt. Why? They don't. Adults, we're always a 10. We hurt to the max. Children, they'll give you an exact number. And then the top one's just 0 to 10 if 0 is no pain. But they say preschoolers up to age 8 are faces, and then it's at age 8 numeric. Gross motor skills. Look what we're doing. We're running, we're hitting balls, we're riding a bike, we're doing a lot of good stuff. Now, differences between the type of ages here. So at age 3, they can start to walk a line and they're starting to skip and walk backwards, and they're on a bicycle, they're catching, they're jumping. By age 4 to 5, Then they're getting more and more. It evolves more. Standing on one foot, tippy toes, hopping, jumping, running over hurdles. One of the things about preschoolers, and as now that they're getting older, remember they're more mobile, gaining more trust in themselves. They're out, they're in parking lots, they're in front yards, driveways, streets, and guess what? They're increased of motor vehicle related injuries. You know how many children I've seen brought in trauma, toddlers, preschoolers that were ran over by a parent, an aunt, or a next door neighbor because they didn't see that child behind them. So it is a real reality, and I can attest to it because I've seen it in the ER. Gross motor skills. All right, as we get older, it's something that when you're younger you want to do and you can't. It's now I'm riding a two-wheel bike, I'm jumping a rope, I'm playing hopscotch. I remember playing hours and hours of hopscotch and jumping rope and trying to be the best at everything. And that's just part of being a preschooler there. One of the things with these preschoolers, challenging them with something they can't achieve will frustrate them. Any age child. If you know a child's unable, it's too early to jump a rope, don't try to. If they attempt it, you can see it's not happening. If you don't, what you're doing is you're decreasing their confidence. Don't frustrate them. Fine motor skills. Look at what we're doing. We're threading things, we're coloring things, we're building things. Oh, we're even buttoning our shirts. Preschoolers getting ready for going to school now. So some of the things that's recommended, parents should promote that positive attitude, should read every night or wherever, during every day, to promote them to like their reading in their books. Okay. If there's any programs, anything's out there to help them. And again, any sort of activities, put them in other groups, kids, and then they can use their arms, their legs, and talk and whatever they're doing, all of those things. And again, parents who speak to their children, not like a baby, but, explaining things properly, it actually promotes their language. Communicable diseases, the ones that we talk about, and it's actually throughout the course, and communicable is actually chickenpox, varicella. Varicella, we say, but there's an immunization for it, right? You still can get varicella with an immunization. So what would I say? Now, I've seen a couple of these working in the ER, and what would I see? Low-grade fever, a very itchy rash, papulas that are oozing, and the generally don't feel well. And you would see actual different levels of healing on the papulas and maculas there. Now, when I see that, I'm going to put on a mask. And the reason is varicella, chickenpox, is airborne. That's the isolation, it's airborne. And then we need to get that child into that a room, which is a negative pressure, which means the air in that room doesn't circulate back in the hospital. It goes out through filters, okay? Now, the other question about chickenpox you see is, what can a child with chickenpox that they know it was, when can they go back to school? And it's when all the lesions are crusted dry. They don't have to be gone, but as long as they're dry, no ooziness, they are safe, okay? Physical abuse, neglect, sexual and emotional. Know that as a nurse, you are that person responsible for taking care of a child. Your job is the child, okay? Know that always suspect any abuse when the histories don't match between the mother, the child, they're not saying the same thing, or the way that they said they got the injury, it couldn't have happened that way. Again, know that most of the time, the person who's bringing this child in is not the one who's the abuser. I've seen it, but usually not. So always, as I've said, remember, somebody's bringing a child in for this. Remember that parent. Until they're proven guilty, know that they're suffering, their child's hurting if they've been neglected. Nutrition. these are just numbers you have to know. Preschoolers, what do they need? What do they require every day? And it's not a lot if you think of it. 12 to 1400 calories, protein for good wound healing, right? That's what protein does. That's 13 and 19 grams. And then strong bones and teeth, because they're growing well, is calcium 700 to 1000. So also know that there are children that do have all sorts of underlying conditions. For instance, with nutrition, what if you are a child who has iron deficient anemia for whatever reason? How can you get that iron deficient anemia fixed? Well, just like adding green leafy vegetables, eggs, and meat. And that could increase the iron in the diet enough to help the child with their iron deficiency. So these are just numbers you have to remember for preschoolers. School age, ages 6 to 12, starts out with their baby teeth start coming out, and now it's gradual development. And now a child's more aware of their environment. As I said, the glass, the small glass, short, fat, tall, skinny, you put the same liquid in each, it's still the same amount. The younger child is going to pick the tall glass, has more in it. The school age child knows they're the same. That's Piaget. That's all about conservation, okay? They're also about same-sex peers, which is all about Erickson. It's also about Freud. Also know Kohlberg talks about what do school-age children do? They're pleasers. They want to please. They want to get praises for pleasing. And boys and girls are still about the same. Injury prevention, which is the biggest injury in any age child? Motor vehicles, from infants to adolescents, whether they're in it, getting run over by it, or now they're driving. Okay. Injury prevention, all about motor vehicles. Okay. Now, one of the things that has been found is a child in school who is doing well, and then all of a sudden they start acting out or start complaining of medical things like stomach hurts or this or these stuff things. Well, when they start to see this, or they start sending them to the school nurse, et cetera, et cetera, when you see a change, this is that stressful environment. I mean, what do toddlers do? They regress, suck their finger, be incontinent. Infants, what do? They cry. But what do preschooler, school age children do? They now can just act out. They don't want to talk about it. So a risk factor for injuries is that stressful home environment, because now they don't care. They're angry and they're out there. Rear vehicles till 13, boosters till 8. I know that ATVs, these are those beautiful 3 or 4 wheel things that I see in the Everglades all the time, not recommended for children younger than 16. They don't feel they have the mental capacity to fight their way if there's a problem or an issue. So it's something that should be passed on. Again, talking to children school age depends on what age they are. I mean, a 6-year-old, I'm going to take a camera and take a picture. A 12-year-old, I'm going to send you for a chest x-ray. Remember, it's the difference of age what you would tell a child. School age disorders, ADHD, something that's usually found out during ADHD, where they don't sit and they can't sit and they're sent to the school nurse, and this poor child is just can't finish anything and it's all over. At that point, school nurse will call in parents. The things, if you ever become school nurses, times parents have done everything to help this child. Many times children with ADHD are said, that's just a spoiled kid. He just doesn't listen. His mom lets him do anything he wants. This is what I've heard with ADHD. It's a disease. It's a mental illness. It needs to be treated, right? So the one thing, remember, take a deep breath and listen. So, mom, what have you done to try to help your son, your daughter? and then together develop a plan of care, okay? Now, as we get older, older school age, early adolescence, we're going through all of these changes and body changes, and we go through these feelings of feeling alone and hopeless. You lost your best friend, your boy doesn't like you, or oh, we're moving, I don't want to move. I mean, whatever. All of these things can cause depression in one way or another. Know that these children, many of them will go through with it. So always take it seriously, whether for your child or for maybe one of their friends is saying those sort of things. And things you might start to see is they start not wanting to go out, they start eating too much, not eating, sleeping, not sleeping. You're talking about death. These things are not normal. If they're depression, this is what depression would show. Dental health should include flossing. Know that children in first grade or age 6 usually can't, do the floss quite yet, but they should be soft bristles, fluorinated toothpaste, and flossing. Here's the chicken pox that I told you about, the signs and symptoms. Another one, Ray's syndrome. Ray's syndrome is when we give children aspirin, like a Tylenol or like an ibuprofen, and you've just had some sort of viral infection, or you have some sort of metabolic something that um, was triggered by the aspirin. These is a very, very serious condition, and it is life-threatening. So we will tell our parents always, never, ever, ever give your child aspirin. You're going to find one diagnosis that you'll be able to, and that's in week 5. And it's a cardiac condition. And we use aspirin to thin the blood. But overall, Ray's syndrome, it's usually after you're recovering from a viral infection like influenza. And aspirin was given for the fever and the pain, and it caused Ray's syndrome. Never, ever take aspirin. How do you open up a conversation with adolescent about their sexual history? Well, it's difficult, but again, open the conversation. Are you going to go to school, or how you? Oh, I see you're in sports. What do you play? Da 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 da. And then, of course, always getting the mother out of the room, and talking to the child and figuring out, if they want to talk about things. I've always said, careful, they're going to say things to try to shock you, and they will, because it's happened to me. Remember, adolescence is that sense of identity. So they're trying to fight what they can do. Moms and dads have to set limits and structures. Remember, the child is trying to fight for, I want, well, I want to play. I'm old enough now. I can take care of myself. Don't worry about me. And the parents are trying to hold them back and keep them safe. It's that sense of identity and that struggle. And then, of course, that body image. Do they have the proper clothes on? Or do they have the newest up-to-date sneakers? Make a difference. Do they are too skinny, too fat, too freckles, too curly? All of that self-image things are important to an adolescent. Remember, adolescents now think they're old enough to touch a gun, and that's when it goes off and they shoot themselves or somebody else. Also, they now are driving vehicles. Know that they may not be as safe as somebody else. So there is an increase there. So know that the leading cause of death is always that motor vehicle, and then it's suicide, depression, right? And homicide, doing risky behaviors. Nutrition, nutrition, nutrition. Adolescents do have that growth spurt, that adolescent growth spurt, and they should eat better, but they don't. So they tend to eat on the go. They grab a bar, they grab a water bottle, and they leave, right? Put it in their backpacks and go for the day. They don't spend their lunch money because they want it for the weekend, and they're not eating right, and they're just eating whatever. and that does affect nutrition. It could negatively or positively, right? Maybe they're eating too much of these fast foods and they're gaining weight, and some are too skinny. Well, how would you know how to treat any adolescent with a weight problem? Too much, too little. 24-hour diary. Again, nutrition, you're worried. Are they enough? Not enough? Do that 24-hour diary. Some of the disorders that can happen, the anorexia and bulimia, and then that restrictive compulsive, and they do all sorts of crazy things to try to limit their intakes. So adolescents are going to get that 3-shot series, HPV. That's in the adolescents. Again, I've talked about adolescents getting their let them have your confidence, and they feel confident in you that they can talk with you. I mean, I've actually had a pretty good rapport with many of the adolescents, but it is difficult, and some will talk, won't, no matter what. Um, how to get it done? As I said, you do broad statements, try to figure out what's going on in the child's life, and then of course get them alone, and hopefully they'll talk to you. Adolescence. Now, you think there's a problem with sleep, and there should be with adolescents. Well, think about it. Well, adolescents don't want to miss a thing. They are on the phone or on, they're texting all night long, a new friend, a new boyfriend, they're up at a basketball game. Oh, there was a dance. And then they have a project due tomorrow and they could sleep 4 o'clock in the morning every day. And that is the sleep deprivation. It's because, all of the school activities. It's normal. And remember, it does affect them. But that's what adolescent school age do. I've already talked about depression, suicide. What these are the things that could be done from. And again, anything towards it, take it serious. Now, Tanner stages of development. I gave my class this PowerPoint, you got it, where you had girls and females. And why did I put this here? Well, I've seen HESI questions about Tanner stages. So how do you remember? Well, one is the immature child. Number 5 is the mature. Number 2 is beginning of stages of puberty. Girls get breast buds, boys an enlarged testicles, scrotum. Okay. And then 5 is the adult. So if a question asks you anything in there, you can sort of figure out, are we at stage 5 or are we lower than that? So that's why I put this here for you. Know that menstruation starts about 2 years after the first changes. First changes, female breast buds. 2 years later, start menses. In the beginning, remember, they're starting menses. It's straight at that pre-adolescent growth spurt. They're gaining a lot of height, right? It is very common for girls to have irregular menstrual cycles. And then again, they're growing tall and gaining because of this growth. And because of puberty, they are moody. The guys are saying, oh, she's getting her period. She's moody. Watch out for her. My brothers used to say that about me. And yeah, you do. Here's 2 dosage calculation reviews. They're for you. You want them, look at them. They can help you. Here's the Kahoots. You can go ahead, just cut them out, put them URL, and you got everything you need to do the best as you can for exam 1. I wish you all the best. Any questions?